Welcome back to Western News as the Ethical Issues in Dentistry series. My name is Philip Tagachek, and I serve as Western News as the Ethics Chair. Today, I'm interviewing Dr. Chui. Dr. Chui went on to receive his DDS degree at USC. After that, he completed his AEGD residency at UCLA School of Dentistry. He was a faculty member at USC before joining Western University. Dr. Chui now is a full-time preclinical faculty at Western U and has been here for the last 7 years. Dr. Chui, thank you much for joining us.
Thank you for having me on.
All right, so can you tell us a little bit about yourself and why you chose to become a dentist?
Yes. So I started I've been always in the health field from the start of my life. My mom was a nurse. My dad was a dentist. I didn't really know anything else besides the healthcare profession. So as I went on in biology, and I wanted to figure out, well, what am I going to be doing after I graduated? So since I was always in the healthcare or around the healthcare, I looked into dentistry because I knew I wanted to become a doctor, but I didn't know a doctor in what field. So since dentistry was in my family already, I decided to go down that route and see where that would lead me. And that's my primary decision of kind of going to dentistry. And as it turns out, it's a really good field. I don't know what other field I would choose now that I'm in dentistry. It gives you a medical aspect. It gives you the skills to work with your hands and working with patients.
Awesome. Can you tell us a little bit about an ethical issue you've encountered in dentistry and how you handled that situation?
One incident comes to mind when I was in private practice. We had this patient that both the covering dentist and I were treating, and the discrepancy was, what do we do with this patient's high caries risk? The patient cannot afford treatment. They have a mouthful of caries. What do we do? And the dilemma was two different pedagogy. My initial theory was, let's handle the caries first and place the patient into a stabilized position, and then let's carry on with definitive care. The dentist had a different opinion and wanted to do what the patient could afford first and what the insurance would cover. So I disagreed with his choice, and we had a bit of a disagreement and a bit of a rough patch. And since I was the associate there, I kind of had to go with his decision. Now that I had a chance to look back on, I should have stayed my ground and go with my gut feeling and go what I personally thought was correct. Or any other future instances like that.
Okay. I guess, if you could go back and, to that moment, knowing what you know now, how would have you handled that situation? Yeah, you've said you'd hold your ground, but, anything specifically, or how would you approach the dentist and talk to him?
I might talk to that dentist and give them my personal philosophy on why I recommended that proposed treatment. And I should have been more adamant of how I felt doing the treatment that dentist recommended. And I would recommend to myself to not be afraid of what that other dentist thought of me, and to believe in my own skill level, in my own my diagnosis skill levels.
That's a great piece of insight, Dr. Chui. I guess the last question now is, what advice would you give to dental students about handling a situation like this in the future? Or do you have any other piece of advice for dental students in dental school?
Trust in what you've been given, what you've learned from your faculty, learned from your peers, and more importantly, start taking what you've learned and wrapping it into your own package, into your own gift, and shape it into your personalized view and make it your own. Give to that patient, to yourself.
That's an awesome piece of advice, Dr. Chui. Dr. Chui, thank you for joining us for the Ethical Issues in Dentistry series. Guys, stay tuned for the next episode. Thank you, Dr. Chui.
Thank you.